first three editions of the World Congress on Interventional Therapies for Diabetes have been instrumental in building enthusiasm for research about metabolic surgery, diabetes, and the way the changes that we impose on the anatomy of the gastrointestinal tract can affect physiology, pathophysiology, and clinical care of diabetes. The last edition in particular was instrumental in conjunction with the Diabetes Surgery Summit to establish evidence-based guidelines that are now endorsed by a record number of 56 organizations from around the world. And yet, despite evidence, despite broad and worldwide consensus on the role of surgery, less than 0.31% of people who meet criteria have actually access to surgery. Interestingly enough, also, type 2 diabetes, which is an epidemic and serious disease, receives far less research fundings than other chronic diseases compared to the size of the problem. So we're going to approach in this new Congress in April 2019 the issue of what barriers are there that impede access to care and actually also impede research funding, appropriate research funding for advancing diabetes research. I think we will explore all the possibilities, but particularly we will focus on the question of whether stigma of obesity, misperceptions around the role of lifestyle in obesity and related diseases such as type 2 diabetes are acting as a barrier, and what are the best ways to address them. So join us in New York for what is promising to be one of the most exciting Congress we have attended, and certainly a way to continue to change the care and the research in diabetes.